Vitamin B12, also known as cobalamin, is an essential nutrition for the maintenance of central nervous system, red blood cell formation, and DNA synthesis. Vitamin B12 is found naturally in a wide variety of animal foods. The recommended daily intake of vitamin B12 for adults is 2.4 micrograms. Not getting enough vitamin B12 from food can lower the vitamin B12 levels in blood and tissue, or vitamin B12 deficiency. Vitamin B12 deficiency is associated with various oral manifestations such as inflammation and burning sensation of the tongue, recurrent oral ulcers, candidiasis, and altered taste sensation. Vitamin B12 levels in the blood are also related to oral health status. Individual behavior in choosing a diet is affected by the ability to chew. Malocclusion and oral diseases such as dental caries and tooth loss can cause difficulties with chewing. Thus, individuals with those conditions tend to avoid eating those foods that could be regarded as difficult to chew, for example, animal foods that are the source of vitamin B12. A cross-sectional study by Chisato Inomata and co-authors that was published in 2014 found that, rather than just a number of remaining teeth, intakes of vitamin and dietary fiber were more closely associated with occlusive force in independently living older Japanese. The number of remaining teeth did not indicate the number of occlusal contacts. So, consuming food that triggers a more active chewing movement will increase the occlusive force because it has an impact on stronger chewing muscle tone. There are some of the groups who are at risk for vitamin B12 deficiency. Vegetarians. Strict vegetarians and vegans who consume diets completely free of animal products are at risk of vitamin B12 deficiency. Older adults. Perhaps up to 1/4 of older adults are affected by atrophic gastritis. This condition decreases the secretion of hydrochloric acid and increases the intestinal bacteria growth in the stomach, resulting in the decreased absorption of vitamin B12. Individuals with pernicious anemia. Pernicious anemia is a disease that causes the parietal cells to lose the ability to produce intrinsic factor. Thus, body cannot properly absorb vitamin B12 in the gastrointestinal tract. Individuals with gastrointestinal disorders, such as celiac disease and Crohn's disease. If you belong to one of these groups, you may want to consider taking vitamin B12 supplements or increasing vitamin B12 intakes. Thank you for watching our video. Remember to always keep a healthy and balanced diet.